Good afternoon, friends. Today we are planning to do commando surgery with PMMC grafting for this CA left buccal mucosa case, recurrent malignant lesion. So this patient is 55-year-old male patient, and this patient operated 2 years back. Now that recurrent growth of the left buccal mucosa again occurred. So the surgeon wants to do a commando procedure with a PMMC flap procedure. This patient's mouth opening is restricted. This patient has no mouth opening at all, and this patient already had taken CT, RT, chemotherapy and radiotherapy before that. So net flexion, extension movement is also restricted. So we'll check mouth opening. Kaka modu kholo ji. So there is almost nil mouth opening is there. So we are planning to do intubation with our mobile or laptop compatible flexible video bronchoscope. So before that procedure, we will prepare the airway, and afterward we'll do nasal intubation with our mobile or laptop compatible flexible video bronchoscope. Okay, we have also given 4% 5 ml lignocaine nebulization 30 minutes before shifting to OT, and we have also given injection glycopyrrolate anticyalog to avoid the excessive secretion during our bronchoscopy procedure. Okay, and now first we'll check nasal patency for the intubation. So I will tell patient to compress the one nostril and breathe from other nostril, and do same thing from opposite nostril. So whichever nostril will be more patent, will do intubation or will put tube in that more patent nostril. કાકા આ બે નાકમાંથી કયું નાક વધુ ખુલે છે? આંગળીથી ચેક કરો. આંગળી આ એક પેલા આંગળીથી એક નાક દબાવો અને બીજા નાકથી શ્વાસ લ્યો. ઓકે, વધુ કયું નાક ખુલે છે? આમ આમ પ્રેસ કરો. So patient's left nostril is more patent, so we'll put ET tube in left nostril. Okay, now we'll do airway preparation. We have already given lignocaine nebulization half an hour before procedure, but to add for nebulization, we'll also give superior laryngeal nerve block as well as transtracheal block. So we'll give bilateral superior laryngeal nerve block as well as transtracheal block, and still if require any like during procedure, if any patient will fight, then we'll also do local topicalization of lignocaine via working channel of bronchoscope. Okay, and we'll also put lignocaine 10% spray over the soft palate, and in nostril, both nostril will do lignocaine nasal spray as well as we'll put oxymetazoline nasal drop to strengthen the mucosa and to avoid the excessive bleeding during intubation procedure. Okay, thank you. Yeah, now we'll do airway preparation. We'll give airway blocks, and afterward we'll start our bronchoscopy guided nasal intubation. We have already explained about procedure to the patient, and we have taken written informed consent from patient. So that step is very important, because patient cooperation must be needed before awake nasal intubation procedure with bronchoscope. Okay, and this airway block is also very important, because if patient will feel uncomfortable or patient will fight during bronchoscopy procedure, then it will be very much difficult to do bronchoscopy, and if bleeding or anything trauma can happen. So airway preparation is very important step. If you have done airway preparation properly, then your 50% work will be done. Okay, so I will do airway preparation. First we'll do painting and wrapping over the neck area, and then we'll give bilateral superior laryngeal nerve block as well as transtracheal block. And before this block, I will sedate the patient with 50 microgram injection dexmedetomidine plus 50 milligram injection ketamine. So patient will be lightly sedated before airway preparation procedure. So patient will cooperate for procedure. Okay, give 1 ml. bilateral superior laryngeal nerve block. For that, first we'll palpate the greater corner of hyoid bone. This patient had already taken chemotherapy and radiotherapy, so neck fibrosis is already there, so it will be very much difficult to palpate the greater corner of hyoid bone. Yeah, I am able to palpate the greater corner of hyoid bone on left side. So I will hit the greater corner of hyoid bone and just redirect the needle inferiorly, and at the inferior border of greater corner of hyoid bone, our superior laryngeal nerve will be there. Kakak exhale action. Yeah, I am hitting greater corner of hyoid bone, so I am going just inferior to the greater corner, at the inferior border of greater corner of hyoid bone. I am redirecting needle inferiorly. Yeah, I will inject 3 to 4 ml of lignocaine after negative aspiration. Yeah, same thing we'll do in opposite side. Yeah, right soil action. Yeah, I am hitting greater corner, so I will redirect needle inferiorly and going towards the inferior border of greater corner of hyoid bone. Yeah, I will again inject 3 ml of local anesthetic. Yeah, so bilateral superior laryngeal nerve block I have already given. Now I will give transtracheal block. So for that you have to palpate the cricothyroid membrane, and you have to do transtracheal block with 5 ml of injection lignocaine. So I will do transtracheal block. I will just palpate the cricothyroid notch, cricothyroid membrane. Yeah, I have already punctured the trachea. I will aspirate and will see for air bubble. Yeah, you can see. Now we'll gently inject local anesthetic solution. Patient will start coughing sometime, but coughing will be very much important because due to coughing, that local anesthetic will spread over the tracheobronchial tree adequately. Slowly we'll inject, aspirate and inject. काका थोड़ी उधरस आवशे हो. Yeah, I have given transtracheal block also. Now we'll do 10% lignocaine spray over the soft palate area. What do you follow, Kaaka? will also do nasal spray with 10% lignocaine in fourth nostril. Yeah. And we'll also put xylometazoline nasal drop over both nostrils. Yeah. So I have adequately done airway preparation. This airway preparation is very important, because if airway is not adequately prepared for bronchoscopy, then patient will fight during procedure, and if it can lead to traumatized airway, then it will be very much difficult to locate the trachea, very much difficult to do bronchoscopy, and so this airway preparation is very important step before doing bronchoscopy guided nasal intubation. Now we will do awake nasal intubation with our mobile or laptop compatible flexible video bronchoscope. Okay, thank you. Ready? Yeah. Now airway preparation is done. We have sedated patient with 50 microgram injection dexmedetomidine plus 50 mg injection ketamine, and now we'll do bronchoscopy guided nasal intubation with our laptop or mobile compatible 5.2 mm adult mobile or laptop compatible video bronchoscope. This is our 5.2 mm adult mobile or laptop compatible video bronchoscope. So this bronchoscope we will attach with mobile through USB adapter. We will hold handle of video bronchoscope with our non-dominant hand, and with our dominant hand we will insert the bronchoscope into the left nostril. Okay. We will railroad the ET tube before inserting bronchoscope. Yeah. Out thing, exit thing. Okay. Application is video speaking application. Yeah. Yeah. This mobile we have used as a screen of our video bronchoscope. We will attach suction also. Full screen कर दें. Recording. Record. Full screen. I have entered through left nostril. You can see this is the inferior turbinate. We should keep this dark area, means airway passage, in center of the screen, so it will be easy to negotiate the insertion cord of video bronchoscope. This is the I am going below the inferior turbinate. Gently I am passing my insertion tube of video bronchoscope to avoid the mucosal bleeding, because bleeding is the enemy of bronchoscopy. If bleeding will happen, then it will be very much difficult to do bronchoscopy guided nasal intubation. I have entered into the posterior nasopharynx. Suction 1. I'm gently going towards the oropharynx. Yeah, this is my epiglottis. Below epiglottis, that cord is there. You can see nice view of both vocal cord. You can see nice view of laryngopharynx is there. So I will keep vocal cord in the center of screen. This step is very important because vocal cord will be mobile, and if scope will touch, then vocal cord spasm also can occur. So you have to very gently negotiate the tip of your bronchoscope through vocal cord. This is the most sensitive structure of the airway, so if required, then you need to give local lignocaine spray through a working channel of your bronchoscope. I will spray lignocaine. This is the nice view of superior surface of vocal cord. I will spray 2 ml of lignocaine and 8 ml of air. So it will adequately spread over the superior surface of vocal cord. I will forcefully inject the air plus lignocaine 2 ml. Yeah. Now I will wait for 30 seconds so it will properly get anesthetized. I will keep vocal cord in the middle of my screen. Now I am gently passing through laryngopharynx. This step is very much important, and this is the most critical step of the bronchoscopy guided nasal intubation, because if your scope tip will touch the the vocal cord or laryngopharynx, then vocal cord spasm also can occur. So you have to gently go towards the trachea. You can see nice view of vocal cord is there. I can see tracheal ring also through vocal cord. Yeah, I have already entered into the trachea. Now I will go towards the carina. Once carina will be visible, then I will railroad the ET tube over the insertion cord of this video bronchoscope. You can see nice view of carina is there. Just keep lumen of trachea into the center of screen, so it will be easy to negotiate the insertion cord of your bronchoscope. And second thing is, just see carina and rail rod to the tube. Never hit carina or never touch carina, because carina is the most sensitive structure of the airway. So if slightly if you insult carina like by touching the tip of your bronchoscope, then horrible cough can also occur. So otherwise, just see carina and then rail rod tube. Never try to hit carina or never try to go near to the carina. Okay. Yeah, I have already seen carina tube, so I will rail rod my ET tube over insertion cord of bronchoscope. I will put jelly. You can see my airway preparation is very good, so patient is very much comfortable and is comfortably sleeping during whole procedure. He is not moving at all. So airway preparation is the very important step for successful bronchoscopy guided awake nasal intubation with flexible video bronchoscope. I am just seeing my carina and I am rail rodding tube over my bronchoscope. Smoothly I am rail rodding tube over bronchoscope. Yeah, my ET tube is going smoothly, and I am using 7 size flexometallic tube. Otherwise use flexometallic tube for bronchoscopy guided nasal intubation, because the tube don't have preformed curve, so it will be easy to negotiate or rail rod the tube over insertion cord of bronchoscope. Yeah, you can see nice view of ET tube is I can see. So I will just put tip of the ET tube just 3 to 4 ring above the carina, and I will withdraw the insertion tube of my bronchoscope. Yeah, thank you. I have done video bronchoscope guided awake nasal intubation. You can see tube is inside the trachea of patient, and patient is very much comfortable. That means your airway is properly got anesthetized and you can comfortably do bronchoscopy guided nasal intubation. Now I will tell my assistant to induce the patient with propofol and anthraquarium. Yes, give propofol 10 ml. Then I will inflate bulb. Once propofol will be given, will inflate bulb. Yeah, propofol 10 ml, 100 mg is given. So I will insert the bulb of my flexometallic tube. Now give 4 ml injection atraquarium muscle relaxant. Yeah, I have inflated the bulb and will connect my ET tube with ventilator. Yeah, I have connected and I will see waveform. Yeah, you can see that proper respiratory waveform is coming in volume control mode of ventilator. So my tube is inside the trachea and patient is getting properly ventilated.